Hello, I'm Dr. Vishal Sharma, founder and managing director, Oriheal Lifesciences and Pets Planet India Pet Hospitals. I started Pets Planet India Pet Hospitals in 2001, and as I was a practicing veterinarian, so during my practice, I found a great need of some safe and effective medicines for some chronic diseases like chronic kidney failure, hepatitis, liver cirrhosis, atopic skin disorders, and tick fever, and many other ailments. So at that time, these kind of medicines were not available. So I researched a lot and studied the available study material, and I took the help of experts, and we developed some formulations for pets, and by that the Oriheal Lifesciences came into existence. Now I proudly tell you that we have hundreds plus pet products and medicines as our range. At Oriheal Lifesciences, our priority is our patients and our profession. Our mission is to develop most affordable and most innovative pet medicines and pet products, and we want to add value to our Indian veterinary industry. Our goal is to become a global healthcare organization, and we want to bring Indian veterinary industry at par with international standards. Thank you for being a part of this incredible journey. Thank you.
If we were doing a basic lecture in canine medicine, we probably wouldn't be spending a lot of time talking about stress. But stress is it's a very important component of health of cats. And so I'm going to spend a little bit of time talking about this in today's lecture. And stress can have multi-systemic impacts on a cat's health. So any disturbance in the environment, in the emotional and physical well-being of a cat counts as stress. And how does a cat respond? The cat responds by facing the fear, by coping behaviors, and it goes back to baseline. How a cat responds to stress depends a little bit on the genetic makeup of the cat and on its previous experiences. And sometimes they say there's a sensitive period when they're kittens, about 2 weeks to three months old, when their experiences can impact how they then respond to similar situations in the future. So your first kitten consults in the clinic are very, very important, even in the long term. When the acute stressor doesn't go away, whatever the stress is, it's not abating, it's not going away, or the cat for some reason is not able to cope with this stress, it's not able to go back to baseline, this is called distress. And distress is what then leads to the health implications that we see. They now describe a health triad for cats, where they say that there is a physical, emotional, and cognitive well-being that is important for the health of the cat, and that if you're dealing with one without the other, you're never going to succeed. There are subtle signs of stress that people must try and recognize. Withdrawn and hiding. This is suddenly a very active cat goes in after a clinic visit. This happens very much after sterilization or after a clinic visit. The owner will say, now he's been hiding for 2 days. Becomes less tolerant of people, hesitating to use the litter tray, eating and drinking less or more than usual, scratching excessively, vocalizing, showing aggression, crouching and looking tense, exaggerated swallowing, licking their nose often. This can be nausea as well, I might point out, or in extreme cases, vomiting and diarrhea. I'll mention at this point that the signs of stress in a cat are very similar to the signs of pain and the signs of sickness. So it's very important, again, to be able to work through these in a cat or in a feline patient, and to recognize that it might not be something medical, it might be stress that
Ma'am, please unmute yourself. Ma'am, please unmute yourself, and you'll have to repeat a 1 minute's old thing also. Unmute yourself.
Am I now unmuted?
Yes, you are audible.
Okay, sorry about that. I don't know how that happened. Thanks for letting me know.
Yes.
Okay, So I'm going to go back. So I mentioned about stress, and I said, now this cat is getting a treat in the clinic. He's nice and curious. His ears are forward. He's smelling the treat. He wants to know what it is. He looks relaxed. His body position is not identifying any fear or threat in this case. He's curious. So this is a cat who's obviously not, as opposed to the one we saw in the earlier slide, who's not showing a lot of stress. Okay. When we look at the pathological manifestations of stress, that means stress that becomes a disease. It's important for a feline practitioner to understand the influence of stress, distress on the environment on the expression of illness. Today, they've identified these are the ones that are common, but there are a multitude of different health manifestations or physical manifestations of stress in cats. To just walk you through a few of them, obesity, we know that when cats are anxious, when they know that they may not always have access to their food, it tends to overeating and obesity. There is something called feline hyperesthesia syndrome, which I'm going to show you, hopefully, if my video works, in the following slide. FIC is feline idiopathic cystitis, which we are going to talk about. There is some anecdotal evidence that the dysbiosis or the overgrowth of bad bacteria and IBD is linked to stress, but it has not been proven to date in cats. We all know about stress hyperglycemia in cats. So stress can cause an increased blood glucose in cats. And this must be differentiated from diabetes mellitus or other causes of hyperglycemia in cats. I don't see it often, but apparently it can also cause transient glycosuria or glucose in the urine. So how then do we differentiate a stress hyperglycemia from a diabetes mellitus? I mean, one of the sort of sensible things to do would be you have a high blood glucose, maybe on 2 separate occasions, and it's significantly high, more than 175, 200, 250 in the clinic. You ask the owner to go home, take the cat home, and after 2 days, bring you a urine sample. So you've just separated out the 2 occasions and then check the urine for glycosuria. This is just a suggestion. Over grooming. So the cats will often overgroom due to pain, due to some dermatitis issues, and it can be behavioral or stress induced. And there is something called feline orofacial pain syndrome, where they keep pawing at their face and it mimics dental disease, but the cat's teeth and mouth are actually absolutely fine. So a little bit about hyperesthesia. It's basically a poorly understood syndrome where some cats who have a predisposition to anxiety will show symptoms of, rippling of their skin on the lumbar vertebrae, increased and manic activity, face pawing, excessive vocalization, and sometimes this progresses to tail chewing and tail biting and mutilation as well. Okay, so this is a cat whose owner had sent me these videos. I hope I can play them. To FIC or feline idiopathic cystitis. I'm going to introduce a term today, which is FLUTD or feline lower urinary tract disease. We will cover it in more depth in the emergency and critical care lecture where we talk about blocked cats. But basically, there's a wide range of symptoms that wide range of conditions that cause similar symptoms, and all of these symptoms are related to the cat finding it difficult to urinate or urinating abnormally. So there is dysuria, there is pollakiuria or more frequent urination, there is hematuria, there is sometimes stranguria, and stranguria means the cat cannot urinate, and that can become an emergency. Of all these conditions, so there are many different conditions. The most common cause of FLUTD is feline idiopathic cystitis, which means there is an inflammation of the bladder, but we don't know what the cause is. We've ruled out all the known causes and we are left with FIC. Today we know because of there's someone called Tony Buffington, and he's done a lot of studies, and he's coined this term called the Pandora syndrome. And we know that comorbidities are common. When you have a cat with FIC, you got to look for the other comorbidities as well. And they're often GI, respiratory, endocrine, neurological, and we know that stress is implicated in the development and playing out of FIC. The risk factors are common for most FLUTD cats. That is, the cats are usually sedentary, they're indoors, they're overweight. They're often neutered males 4 to 7 years old, and they can be from multi-cat households. So when you have a cat who comes in with FLUTD, the owner says, my cat is sitting in the litter tray and not coming out. He's trying to urinate, but nothing's coming out. Or he keeps going back to the litter tray again and again and again. You have to rule out urolithiasis, urinary tract infection, neoplasia, other physical abnormalities before a diagnosis of FIC is made. What do we know today about FIC? The reason that I've put this radiograph in is actually it's one of my favorite radiographs, and it shows you the passage of the urethra in a cat, the distal urethra. So this is the bladder in the caudal abdomen going down to the urethra on the pelvic floor, and these lovely little chain of uroliths has actually identified the passage or the urethra in this cat. This is the neutered scrotum, or what is the remaining scrotal pouch in a neutered cat. This is the prepuce, which seems to be a little swollen, and this is the urethra, and this cat has urolithiasis. It's important to rule these conditions out before we make a diagnosis of FIC. Again, if the cat truly has FIC, there is a very high rate of recurrence. It can be very, very frustrating for you as the practitioner and for the pet parent. It's important to warn them at the beginning. There's almost a 50% rate of recurrence if it is an FIC within the first 24 to 48 hours, and there is almost a 10% recurrence in the long term. Complete stranguria. So stranguria means the cat is trying to urinate, but there's no urine coming out. It is an emergency, because if you have a blocked cat for more than 48 hours, there's a lot of electrolyte disturbances that can cause even death. With FIC, we see waxing and waning of symptoms. The cat will be fine for 6 months. Again, there will be an episode. Again, the cat will be fine for some time. Again, there will be an episode. And usually these are managed. The acute incidents are managed with anti-inflammatories and analgesics. We use buprenorphine a lot, transmucosally. We use prazosin as well. Nowadays, there is also tamsulosin, which is used, which is gaining popularity. And this decreases urethral spasm, especially when there is no obstruction, like in this case, and allows the cat to urinate. The long-term management of FIC indicates or includes feeding canned or wet diets with more than 60% moisture. So I also want to mention at this point that we did not talk about home-cooked diets and raw diets, because that is actually out of the purview of this course and lecture. But should we ever want to discuss it, or anyone has a keen interest on discussing it, I'm happy to share my experiences. Feline facial pheromones. So we talked about pheromones. These are special scents that are used for communication in cats. These are scent hormones or that the cats use. And there's one in the cheek and chin gland, which is called the feline facial pheromone 3, which reassures and calms the cat. And it has been put into a synthetic form, which is called Feliway. And I think I have a slide on this later. And this Feliway has actually been shown to have a dramatic effect in a lot of stress-induced conditions in cats. Locally, we do get some companies, Feliway is available on Amazon also, but who are also copying it, and there are varied sort of responses to it. Some people are happy, some people are not so happy, but it's just to introduce to you that there are some adjunctive treatments as well. Glucosaminoglycans, which help. So we have a cystitis, we want to rebuild bladder wall. Pentosan polysulfate have all been discussed, and there are many nutraceuticals which have this. There's Cystade cat, there is Furinade cat, there's a lot of these supplements, Urosupport, which are all used. They have a calming component which helps to calm the cat Okay, sometimes it's L-tryptophan, which is an amino acid, it's natural. And then they have components which help with bladder wall healing. In case of refractory FIC cases, amitriptyline can be used. I do have a table later with some more drugs that can be used. This is the dose that I usually use it at. It can cause some urine retention, but in a larger sense, it's safe. It's important, though, when you're using drugs that you also do what is called MIMO, or multimodal environmental modification, because just drugs alone will not help, and the drug should be short-term and slowly weaned off when the modifications kick in. Okay. The AAFP, which is the American Association of Feline Practitioners, they have identified 5 pillars of a healthy feline environment. One is provide a safe place, provide multiple separated key environmental resources: food, water, toileting areas, scratching areas, play areas, rest areas. Provide opportunities for prey and predatory behavior. Allow them to chase and allow them to run away from things. Provide positive, consistent, and predictable human-cat interaction. And provide an environment that respects the importance of a cat's sense of smell. Quite easy, it sounds, but not always practically that easy to put in place, especially in a multi-cat household. You have to, especially if you're in an apartment in a city and you have 4 cats. So when we're thinking outside the box, we're thinking about urine marking behavior. Some cats will go around marking incessantly. Some cats will have recurrent FIC episodes. What you want, the multimodal modifications are very similar in these cases. Okay, you want to increase your number of litter box. You want to look at the hygiene of the litter box. You want to again give them several sources of food and water. You want to give them a consistent routine, and you want the interactions with the owners to be good. Play with the cat for 10 to 15 minutes a day. And there is something called alpha casozepine, which is from milk casein, the enzyme from casein, and we will also talk about this later. So there is a paper by Carney, and if anyone is interested, I can send it across. It's very, very interesting, and they're talking about these MIMO strategies. And this has it's not just airy-fairy, these are some things you can try. This is very important in your communication to the owner, because there was the reason that these got put into place is because they worked in a shelter where there were almost 1,100 cats that were given up by households because of urine spraying and urine marking. Cat urine is extremely foul smelling. And when a cat develops urine marking behavior or FIC and they're soiling on the sofa or on the bed, headboard of the bed, it's very distressing for owners, especially when they don't have a solution and they see they're doing lots of tests, but it's recurring. And what they found is all these cats had been tried with amitriptyline and other medication, clomipramine, and they had been given up and they were due to be euthanized. And they ran a study and they put in place multimodal environmental modification. And they had, close to 92% success, which is really commendable. So to explain to the owner that these things might take you a year, suddenly you tell a cat, I'm going to play with you today. That day itself, the cat may not play, but you got to figure out what the cat wants to do and how it wants to play. And it may not always be successful because you may not be able to remove the source of stress, but trying to identify it and putting the simple things in place is always worthwhile. So these are behavior modifying therapies. That is, give it a hiding place, especially elevated perches. Okay, make a safe place for a cat. Feeding, allowing them different feed in different areas where they don't have to cross other cats that they may have aggression towards, or they may be antagonistic towards. Litter in different places. Stress-related behaviors and syndromes, identifying it, working with calming therapies and drugs if necessary, and of course, feline facial pheromone. They found in acute cases of FIC, actually just using this Feliway had about a 95%, 94.5% success. So obviously, there is a lot of a stress component in these situations. It is very, very expensive. So that is, again, and one of these diffusers may last about a month, I think, not more. These are the options of behavior modifying drugs that are used. The common ones are amitriptyline, clomipramine, and fluoxetine. Okay, these are the ones that all of these have some possible side effect of urine retention, dry mouth, anticholinergic effects they call them, but they're fairly safe. And they should be weaned off. If they're being used, then you use them for a period of 2 months. You assess for effect. You try all your other environmental therapies. For example, if a cat is urine marking, again, it's important. How is the cat urinating? Is it urinating outside its litter box on the floor and normal amounts, which may be FIC, and the urine is abnormal? It may not have bacteria, but it may have blood cells in it. Or is it putting normal urine, small amounts, against a vertical surface with its tail raised, which we know as urine marking? The multimodal environmental modifications might be the same, but your diet, there are urinary support diets, which are called, like urinary SO, etc., Hill CD, which may not work so well for urine spraying, which is a markedly behavioral response. So it's important. The history from the owner is important in these cases. Moving on to wild vets and establishing. So now we've understood and we've talked about, we are at 1 hour down. I'm okay with time, Dr. Sharma. Everyone is awake and not fallen asleep. Shall I go on? Okay, I think Dr. Vishal Sharma is not around. I'm just going to plow on. So what happened is during the lockdown, we were seeing a lot of cat clientele, and we decided that we are going to try and do something little for them. And we divided the clinic into the cat corner and the dog den, which is basically 2 separate areas where we treat cats and dogs. And the ISFM, or the International Society for Feline Medicine, has a wonderful accreditation program for cat-friendly clinics. And they actually give you, it's available free online. They give you a whole catalog of all the different small things you can do, because they're actually really simple steps that you can put in place to make it a better client and cat patient experience for your feline patients. 52% of cat owners said that they do not like taking their cats to the clinic because how fearful their cats get and how unpleasant it is. If we can make it better, we have a lot of cats coming in. If we can try and make it better, it just helps to build fidelity. So it's important for the team to understand, the veterinary team to understand the importance of this. The cat-friendly clinic, you look at everything from transporting the cat to the waiting area. Dr. Vishal Sharma, I'm just asking if I'm okay on time. I'm okay on time?
100%,
okay.
100% in time, yes.
Okay, wonderful. So, waiting area, the exam room itself, and then the wards and cages. So this is a cat, obviously, that's communicating with you before it's going to hit out and swipe you to tell you, you know what, I'm hissing at you, I'm open mouth, and I'm telling you to stay away. I'm feeling unsafe, I'm telling you to stay away. Some of these cats come in very anxious. They've had previous bad experiences. If we want to start off with a fear-free visit and we know a cat is like this, it may be important to try some pre-transport anxiolytics. These can be given 1 to 2 hours. 1 is too short. I think 2 hours is a good time. The peak effect is about 2 to 2.5 hours after giving the medication. Gabapentin at 10 to 20 milligrams per kilo or 50 milligrams per cat. I try not to go above 20 milligrams per kilo. So if you have a 2.5 kilo cat, you should not go above 50 milligrams. And trazodone, these are both available quite commonly at a human pharmacy or chemist, and in general quite safe to use. Gabapentin has a dose reduction in CKD patients. So if you do not know the kidney status of your feline patient, it may be wise to go to the lower end of the dose. You can even start at 5 milligrams per kilo, but there's not a lot of anxiolysis that happens at that dose. Alprazolam, Oriheal Lifesciences, has a very nice syrup. Sometimes compounding these drugs for cats gets a little difficult. And the syrup, which is chicken flavored, makes it very easy to use. Thank you for that. But I don't use that very often. I tend to stick to Gabapentin or Trazodone. Transport starts, you've now got the cat, you've securely put the carrier in the car seat so it doesn't move around or fall down in the car on the way, and the cat comes to the clinic. Some very aware clients will cover the carriers with it's a nice secure lockable carrier. This is the safest way to transport a cat, not in those backpacks with a transparent fronts. Again, cat, it's very shallow. The cat has nowhere to run away. The cat may not want everyone in the world to see them. The natural propensity of a cat is to hide. Okay, the carrier gives it space to hide. So this person has covered it, so the cat is a little calmer. These little things do help. This is a cat bag on the right, and this is an old cat who's come in. This is an absolute no-no, carrying the cat on the shoulder or, bringing it on a scooter without anything, because again, we know flight over fight. If something scares it on the road, it will scratch this owner and it will run, or it will run from the clinic. And then you have laws and you have insurance and all these sort of things, and the poor cat, apart from everything else. So all of them should come in a secure lockable carrier. The plastic baskets with the lock is okay, but if they are big cats, they can often raise one side and still run away. So that's something to be careful of. Moving on to the waiting area. If you can have a separate waiting area, wonderful. So we have done a little bit of modifications where we have a waiting bench where the owner will sit on top and the carrier can be parked underneath, or we have a little cat parking, which is actually elevated. So some cats like to be elevated, and they can be either facing the wall or facing outside, depending on how anxious they are, and they can be covered as well. We don't use Feliway. It's a little bit expensive, but we do use a few drops of lavender oil. I don't know if it works for the cats, but sometimes it calms us when we're waiting for them. If you can't have a separate waiting area, which is separate from dogs, a dog doesn't come and sniff in the carrier door, then it may be important to have a separate timing just for cats. If someone calls in and says, look, we have an anxious cat and we'd like to come and have a separate timing in the day where you see only cats. Just a few suggestions if that is possible. Everywhere else space is not such an issue as it is in Mumbai. And this is a cat who's very relaxed, obviously, in the waiting room. But again, this is not advisable to have a cat lounging around. Again, in this respect, resident cats. So a lot of clinics have resident cats. It's very, very common. They should be given an area away from the outside so that they are not always in the middle, because they themselves can be a source. The smell of a resident cat or the sight of a resident cat can be a source of stress for other cats who come in. Again, it is preferable to have a separate exam room. In the cat corner, we've actually built in a cat tower. They say that your ideal exam room for a cat should have a place to hide, a place to perch, and a place to scratch. And once you allow this cat in and allow it to roam around, again, you have to judge which cats you can let do this and which cats you can't. I'm not going to take a feral cat who's come in and they've spent the whole night catching it and let it free in my exam room. But, if it is a little kitten who's come in, or if it is a pet cat who's, friendly and calm, then it's okay to let them roam around and investigate before you go in and examine them. A cat weighing scale is quite important. It can be just a neonatal weighing scale like this. It doesn't need to be any specialized piece of equipment. And a little bit of white noise or cat calming music. Again, I don't know if it calms the cats, but it can calm the owners or the pet parents. If you're going to be keeping in cats, similar thoughts apply where, stainless steel is okay, but sometimes the fiberglass cages are better. And you want to actually mimic a home environment. You want it to be a quiet area. You want it to be big enough so that you can fit in multiple things. So you want to have a place to perch, a place to hide. You want a littering area and a feeding area, which of course in a cage you cannot separate out too much. But as much as possible. And this is a very basic cardboard box. I borrowed this picture from somewhere, but it's a fantastic idea. You just turn a cardboard box like this, or you turn it downwards and you make a little door, and the cat can go in and hide underneath it, and it can sit on top of it. Sometimes they feel safer when they're a little bit elevated. So just some ideas if you're thinking of hospitalizing cats. It also really, really helps, and I should mention this, that if they bring with them a towel or something that the cat is used to from home to use as a substrate, because this really calms the cat. Sometimes we take this out from the carrier and put it on the table and examine the cat on this, and this also helps to calm the cats. Cats, they are inherently resistant to restraint, and with them, with feline restraint, less is more. So the less you have to grab them and hold them down and catch them and cuddle them, the happier they are. And this is an example of a cat on the right hand side. He's a CKD cat and has lost a lot of body mass, and he absolutely resists. He tries to run away every time he's on the table or someone's trying to hold him, and fights endlessly. But if we turn up his carrier and get him to sit down calmly, without any fuss, we've opened the top of the carrier, and these are really nice carriers to have. Also the ones where you can just unlock a clip and remove the top rather than the nuts and bolts on the carrier. So we do a lot of treatments of cats in carriers, in their own carrier, and they seem to like it. If it's possible, allow an option to hide. Okay, this is not always possible. When you're restraining, what are the factors that affect your choice of restraint? Again, they've divided the cats, according to where they come from, into 4 different categories. One is your pet cat. He's used to a lot of human interaction. He's very comfortable with humans. He lives indoors. A stray or an abandoned cat is often a building or community cat, but they've been handled and they've been in a house before, and they're not uncomfortable when they are being handled. You have a street or community cat. So many feeders are feeding cats, so they will come close enough for you to feed them, but they don't necessarily like restraint, and they don't like being handled. And of course, you have the feral cat who doesn't depend on humans for food, who's not used to human handling. And again, it's very important to know if these guys are vaccinated and to handle them accordingly, because safety of the handler is of utmost importance. Some equipment that you should keep at hand is mats, towels, gloves, collars, muzzles, cat bags, and a squeeze cage if possible, or a gunny bag some people use. Just going to introduce some of these for those of you who are not familiar. This is a cat muzzle. This is actually a sedated cat. It's sometimes hard to get these muzzles on. They're not as useful as dog muzzles, but they do work on some cats, and they do help to calm them and get them to calm down for you to do a short sort of intervention. The one above is the cat bag. So this is basically a little bag, and it comes in different sizes. There's small, medium, large, and there's a zipper and lots of little compartments. So there's lots of zippers on all sides. So you can take out one leg, you can take out the other leg, you can take out only the tail. So often we will get the pet parent, we leave them alone in the room with them. So these are cats who are not necessarily aggressive or anxious, but they don't like handling. So this helps because even the comfort of the bag helps them. I just got a little video. Rabies vaccine, we've checked, we've talked about that. Safe handling. They like to be handled on the head and neck. A lot of them don't like scratching on the back, so be aware of that. Allow the cat to come out of the carrier rather than pulling a cat out. If it doesn't, then of course you can support it from under its belly and try and get it out. Don't do the shaking the cat out of the carrier. They don't seem to like that too much. A burrito, you wrap the cat nicely in a towel and it seems to comfort them and you can get a lot done, especially taking temperature, etc., and slowly unravel bits. Treats help a lot to distract the cat. And the other option is to examine either on someone's lap or the carrier bottom. This also really helps in some cases. So these are some creamy treats that the cat is getting, and it's on its own towel or sheet that it's come with. And it's easy to handle. And when we don't need to scruff, we don't scruff. We use other forms of restraint for the cat. And this is a cat whose blood is being taken, who seems to be quite amenable to handling. Again, some more photographs. This is a cat who did have to be scruffed, but the treats really help because even while we are taking blood, it distracts them and stops them from trying to run away or escape. And we do this a lot while we're taking blood or while we're giving vaccines. We distract the cats with some treats. Back to now, we've done everything possible with a nice cat and we have a fractious patient. For example, the patient who's telling you that he doesn't want to be handled, the one who's hissing at you and growling. One option is the photograph at the bottom, where you give them a place to hide. You cover them with a towel and expose only the part that you need. So sometimes we're able to do, subcutaneous vaccines, injections, etc., with a cat just covered in a towel. And this is quite a reasonable thing to do. Cat gloves are these are leather gloves and they're very, very useful, not so much to hold a cat as much as if you have a cat who is aggressive, who will bite and who's running around the clinic, to catch that cat and put it back, a net or these gloves are very, very useful things to have. You can also use a squeeze cage, which I have over here. And unfortunately, again, this is a video, but I don't think it's going to play. But I'll just explain it to you because what it has is basically one movable wall. And this is me on this side holding this sedation in my hand. And there's someone on the other side who's going to, with two iron bars attached to this wall, actually push. It's much like what we use in the zoos. Push this cage to get the cat to come in and get squeezed against this wall. And then what we do is we inject the cat in the thigh. And very soon the cat is sedated. And we use this a lot for sedating fractious cats because this is better than, there's another gunny bag method that people use, but then you can't always see where you're injecting. In this case, you can, but the only thing is you have to be very quick because the moment the cat feels the needle in the leg, it will react and try to jump. So chemical restraint of the fractious feline, when do we decide to use it? So the indications are the cat is aggressive or very, very anxious. You need it slightly immobilized for imaging or any other procedure. And third is if you have a slightly painful procedure, like a lancing of an abscess, which you might manage in a dog without sedating, but in a cat, sometimes it's just nicer for the patient if you can sedate it. So there are different factors, of course, whether the cat is healthy or unhealthy, whether you want a sedation or an immobilization. And the ideal drug should be reversible so that very quickly you can reverse it and the cat goes back home without having to stay in the hospital for a long time. So this is a cat who seems to be lying on its back for a nice VD pelvis radiograph. And my choice of sedation in these healthy young patients is an alpha-2 like dexmedetomidine combined with an opioid. I will often go at a very low dose, 5 micrograms per kilo and 0.2 milligrams per kilo of butorphanol. If I find I need more, then I will maybe add a benzodiazepine like a midazolam. Midazolam is safe as opposed to diazepam in cats. And if I require further, for example, I've decided now this cat needs surgery or it needs some other intervention, then I can always upgrade to adding a ketamine. So first choice is alpha-2 agonist with butorphanol because it's not a heavy dose of ketamine when I don't know what the kidney function is. I would not use it in very old cats. I would be cautious. So this was actually an idea from one of the conferences that I spoke at, where they said that, look, we're going to be starting out in feline practice and a lot of us are not so, conversant with cats. Can you give us a list of don'ts? And I think these red flags are very important. So this is my last slide. And I'd like to discuss a few don'ts so that anyone who's venturing into feline practice or seeing more and more cats, you just want to have some red flags in mind. Number one is cats cannot metabolize paracetamol. So it's an absolute no to give a cat paracetamol. They can have toxicity at very low dosages. It is safe at 10 milligrams per kilo in dogs, not in cats. If you get a cat in with paracetamol toxicity, N-acetylcysteine helps, vitamin C helps, activated charcoal helps if it has been given orally. Okay. Something called FIS that everyone should know about, which is the feline injection site sarcoma. It's very, very uncommon. In my experience over the last, even in the Middle East, I was treating quite a few cats and I've seen maybe 2 cats with FIS. So they say 1 in 10,000 to 1 in 30,000 cats get it. And it is usually associated with an aluminum adjuvant in the vaccine. So the FELV vaccine, which is not available for us, causes it, but the rabies vaccine has also been implicated. So we should know about it. Which is why this sarcoma that develops, it can develop 1 month later, it can develop even 10 years later, and it can be very horrifying for the cat. So they say give the vaccines below the right elbow or the right stifle. So rabies vaccine, right stifle, tricat vaccine, right elbow. It's a little difficult, honestly, to give vaccines at these sites, but you should be aware that this is the recommendation of the working group which works on vaccination, that you give the injections at these sites so that if the cat develops a sarcoma, you can amputate that leg and save the cat's life. Lidocaine is not as safe in cats as it is in dogs, especially when given IV. We regularly use it when we are doing endotracheal intubation, but we use it at 0.1 ml per cat. And whenever you are using it for local blocks, say for a dental or whatever, it's very important to aspirate, because a dosage as low as I think 0.5 milligrams per kg IV can cause neurotoxicity and cardiac toxicity in a cat. So they seem to be more sensitive to lidocaine. ET tubes, when we're using ET tubes, cats are very prone to laryngospasm. So definitely the lidocaine before we use the ET tube. I am going to have a demonstration on an ET tube placement in the next lecture. But we do a lot of ET tubes. I haven't had a problem. The cat has to be either deep enough in anesthesia. That is the preferred way. And don't try too much. If you try once and the cat seems to be spasming, stop. Get the cat deeper, use your lidocaine, and then try again. NSAIDs, they seem to be very sensitive. So meloxicam, even at 0.2 milligram per kilo, should only be used at 1 dose. When we give it after that, we try not to give it for more than 3 days, and we half the dose. So we go to 0.1 milligram per kilo, and we make sure we give it with some amount of subcut fluids at least. We want to know the azotemia status of a patient before we use NSAIDs in a cat. On the other hand, gabapentin and buprenorphine are quite safe analgesics in a cat, as is tramadol. There's a sodium phosphate enema, which is not actually very commonly used by us, which is also toxic for cats and causes metabolic problems. Topical sprays, I just want to mention that cats groom themselves. We've talked about them grooming. So everything you apply on a cat's skin, it's going to lick. So for example, pyrethroids like Bolfo powder, they are not toxic to cats when you apply it on the skin. But if you cover a cat with Bolfo powder and it licks all of it, yes, on ingestion, it can cause toxicity. Therefore, just some caution is advised. Milk is a very big topic, and we talked about alpha S1 casozepine, tongue twister. Lactase, they don't have lactase, so they are lactose intolerant after they are kittens. So they will get diarrhea and a lot of gastrointestinal disturbances if they are given milk. But the casein in milk is calming. So now vetoquinol has come out with a product which has isolated this alpha-1 casozepine and put it in. It's called Zilkine, and which is we don't get it here, unfortunately, yet, which is supposed to be very calming for cats. And we saw it was used in FIC cases. Some resources I would like to point you to. So there's one little joke I would like to end with. So a cat's ears has a lot of muscles. It has 32 muscles. And the main use of these muscles in a cat is to ignore you. Sorry, I can't hear the response. I'm sorry if it was a sad joke. Just some resources I'd like to point you to. This is the ISFM guide to cat-friendly clinics available online. A wonderful, if any of you have cats, are working a lot with cats and want to understand a little more about cat-to-cat interactions, communications, behavior, Think Like a Cat is a wonderful book. She also has an Instagram account, and just some basic cat handling and cat keeping resources that are available for you. Thank you very much. I'm very sorry if I've taken up a big chunk of your Sunday afternoon. I hope you found it useful.
It was really wonderful. And I believe you can open the chat box on your side, and there are many queries already pending here. So you can take up these queries a little bit.
Okay.
You can scroll this chat box from.
Yeah, let me see. So some of them I have answered. If I haven't, you can always place them again. How to handle a ferocious cat. So we would use, if it's really ferocious, we would use chemical restraint. This is also nice for the cat because it doesn't, it's a painful procedure. The cat doesn't have an unpleasant experience and it doesn't react badly the last time. There are several sources that state that lavender oil is safe. Wonderful question, Dr. Meena. Yes, I should have mentioned at this point that we never ever use essential oils directly on a cat, number one, and never undiluted. Okay. So what we do is we literally put 2 drops in the whole diffuser and it diffuses in the air, and that is not unsafe. But yes, we never use any essential oils directly on a cat because, like we know, they groom and they can ingest it. Can we give dextrose 5% intraperitoneally if a cat has hypoglycemia? Dextrose 5%, again, I think a good question because I should mention at this point, but that anything more than dextrose 2.5% is irritating subcutaneously in a cat. So if you want to give dextrose 5%, it should be IV. I don't do a lot of intraperitoneal injections in cats. Sterility wise, maybe I would worry about it, but it could get absorbed. I presume it's a little hypotonic, so I would worry about that as well. So maybe I would avoid doing this. If you get a 40 or a 50% dextrose, a 1 ml per kg added to your NS and given IV is possibly a safer route. Okay. Thank you so much. Some people are saying wonderful. Thank you. I hope it's not too much information. Sometimes I struggle with how much is too much. Is cetrimide and gamma benzene hydrochloride safe for cats? Oh yeah, this is Savlon. That's a good question. That's a good question. Cetrimide. I don't routinely. I would have to look this up, Dr. Nikhil. I apologize. I don't have a 100% sure answer for this for you right now. I know I don't use Savlon for pre-op. Savlon or whatever that. There's another product that we get that's the yellow cetrimide with gamma benzene hydrochloride. I know people who are using it and it hasn't been unsafe, but I do know that if you leave a little bit in the fur and then they get up and they lick that, they start foaming and frothing and it's horrible. So chlorhexidine is a better choice, or povidone iodine may be a better choice. But I will look this up and thank you for this. Can you please tell about vaccination spots on the body? Yeah, so these are the if you look up the vaccination guidelines, next lecture, there is a little bit more about vaccinations. And we unfortunately use 2 vaccines only in India in cats, which is the tricat and the rabies. I do not honestly stick to the below elbow and below stifle. I find it necessary to tell you. I do have a colleague who does actually, and I think that's really good because I find that, you know, on one hand, you're trying to manage welfare and this cat, there's hardly any skin over there and you're trying to push your vaccine in and, you know, cat can move its legs. To restrain a cat's legs and hands is much more difficult than to give a vaccine on the back. So I try and mark where I've given the vaccine so that if there is a reaction later, I've marked which vaccine went where. So I say right flank, left flank. I try not to go higher up on the neck when I'm doing a vaccine. But the recommended spots are right stifle, rabies, right elbow, distal to the right stifle for rabies and distal to the right elbow for tricat. Safest tomcat catheter. Yeah, so this is a good question. Omkar has asked in a cat suffering from FIC. We are going to talk about blocked cats. So when the cat is coming in, before you've ruled out anything else, you don't know if it's FIC. We do have an emergency and critical care lecture that is, I think, last, Dr. Vishal Sharma, and in that we will be discussing this in a little more detail. What food do you recommend for multi-cat households? The price factor plays a huge, such a good question from Indra Neel. So this is a very good question. So I usually, and I don't know how scientifically backed up I am on this, I tell people, look, your wet food is 75% water. You know it's more protein. You know it's not carbohydrates. Yes, when you buy a cheap wet food, you may not be getting the best quality ingredients, but at least you know that, if you buy some of the brands, the economic brands of the sort of clinically approved wet foods, Whiskers, for example, just as an example, you're not getting the best ingredients. You're not possibly, you pay for what you get, right? But since it's 75% water, since it is more protein than carbohydrate, it is better to feed a cheaper brand wet food than it is a cheaper brand dry food. Whereas if you invest in a little more expensive dry food and make sure you're sticking to 35 grams per cat per day, again, which will be a challenge in a multi-cat household. One cat will eat up all the other cat's food. So the multiple feeding areas, multiple feeding times, multiple feeding places, all this comes into effect. Then you not only feed less, but you also land up getting more bang for your buck because you have a more nutrients and a better quality ingredients that should meet your cat's requirements. So how to differentiate male and female kittens? Yes, this is coming up in the next lecture. Very, very important. And I have been a victim of this as well. So I have learned the hard way. What are you using for regular disinfection at your clinic? Yeah, good question. So we actually use a very, very dilute the Savlon disinfectant, the cetrimide. Right now the name escapes me, but we use that. We've also tried using Envirol, okay, for our cages and things like that. And we dilute it quite a bit. And what we do is at the end of whatever we use, like we do with ET tubes, at the end of your scrub, if you're going to be reusing them, which you shouldn't actually, but you do a rinse with normal water. So we do a wash with normal water after, okay? Can we use xylazine in cats? Absolutely. Xylazine was used for a very long time in cats before the newer medetomidine or dexmedetomidine came in. You do get very low heart rates and the safety margins are not that great with xylazine as with the newer ones like dexmedetomidine. But yes, a lot of the shelters are using xylazine ketamine very safely, very effectively. It's all about developing a safe protocol. What is the ideal body weight and age for spay and cat? Akashdeep Singh, we will be discussing this again in the next lecture. Thanks for the question. Could you throw some light on midazolam per rapili? Good question. Or in the nares for sedation? Oh, so I don't use it in the nares. I use it in birds in the nares, not in the cats. So I must mention in context to this that there are 2 drugs that have been actually approved by the FDA for absorption transdermally from the ears, okay? And one of them is mirtazapine and one of them is methimazole. None of those formulations are available here. Methimazole is used for hyperthyroid cats. But mirtazapine, again, being an appetite, so your cat is not eating, you can't, the owner is struggling to feed another medicine. So there is something that gives you a transdermal. So these are very promising things. They say that sometimes you can use on them as well. I haven't actually tried it, but feel free to try it. These are anecdotal. How to manage paracetamol toxicity, I talked about it a little bit. We will be talking about it as well in emergency lecture. It's one of the common poisons. Is homemade food not safe? Not advised. Okay. No, I think that if you're going to do homemade food, the problem with cats is that they are so fussy that it becomes very difficult to give them a balanced diet that they will eat. So number one, because we know that they require 30% protein as opposed to dogs who require 12%, as opposed to humans who require 8%, you have a much higher protein content, you have almost no carbohydrate content, you have a medium fat content, and you have fiber. It doesn't resemble our food at all. Like you can feed our food to a dog and you can fortify it and, it's not the best, but it's okay. But with a cat, you can't do that. So if you at least keep the dry food component of the diet, because also if you feed only wet food, they get a lot of tartar. So it's also good to them. Again, all prescription diets are dry food. So if your cat is not used to eating dry food and tomorrow it has a sensitivity, a food sensitivity, and you need to feed ultra hypo or hypoallergenic, this is only available as a dry food. So it's a little difficult to correctly formulate and get a cat to eat. So it will choose and eat only what it wants and leave the rest. Cats are very fussy. But if people can get a nutritionist to give them a diet and manage this, ideal world, then there's no harm in replacing the pouches with wet food which is home cooked. This is my opinion. What is an antidote for ivermectin toxicity in cat? It's intralipid, right? You have to keep intralipid in your emergency box because that's the only known antidote. You have to give them intralipid and you have to support them and you have to control the seizures until they wake up, and sometimes it takes 48 hours. Can I visit clinic to see your cat? Yes, Dr. Nikhil is always. Everyone is very, very welcome to please come and give me feedback. You'll be surprised by how small it is. In reality, ma'am, the OPD gets a lot of patients who can't afford a commercial diet. Oh, recommend a home cooked diet. That's a good point. I mean, it would be worth getting a nutritionist, maybe like Dr. Dhananjay Pandit, to come up with a good home cooked diet for all cats. With 3 protein options. It's quite a difficult thing to do because you can give them home cooked food. A lot of them will eat half boiled egg. A lot of them will eat fish and prawns and chicken mince. But you're not meeting the calcium phosphorus ratio. You're not meeting the correct amount of fat, the correct amount of fiber. How are you going to give them fiber? You put in vegetables, the cat is not going to eat it. So it causes acute. Someone asked what effect diazepam has when given orally. So it can apparently cause acute hepatic necrosis, and the cats can die when it is given orally. So diazepam is not advised orally. It doesn't seem to have the same effect always when given IV. So that's a bit odd. Yes, this HB1A assessment is a very good question. On average, for blood glucose over 100 days, can diabetes be checked? I don't think any of our lectures are going to cover diabetes. So I'll take this question very quickly. Yes, so diabetes mellitus in cats is a sustained or a persistent hyperglycemia with a glycosuria. Okay. You should think of diabetes mellitus when your cat has a blood sugar of more than 200 or 250 in the clinic. You should start ruling it out. 160, 170, 180 can often be stress hyperglycemia. So in cats, fructosamine has been validated. For some reason, the HB1AC is not as validated in cats as it is in dogs and humans. And I recently read this up. Having said that, people are using it to corroborate, but the fructosamine seems to also work quite well. Okay, so that's about diabetes mellitus. It just gives you over a 14-day period what your hemoglobin has, what your blood glucose has been. Is egg suitable for cat? Yes, egg is not a problem for cats. How safe it is for a cat to eat dog food? No, because dogs need much less protein and more carbohydrate. So the dog food contains much more carbohydrate. What happens? So what happens when the cat eats only dry food is that it has to eat a lot more food, more volume of food to get the protein it requires, because it's using protein for energy, not carbohydrate for energy. That's the way the cat is designed. So in eating all that carbohydrate, then it has to get rid of all that carbohydrate. So number one, it puts on weight because it needs to eat more than normal food or you'll be starving your cat. Second is they start developing problems of obstipation, constipation, megacolon, because they are having to eat a lot more volume of food to actually meet their protein requirements. Okay. You can further post questions. Okay, Dr. Kanika is saying that they can post. Are we over with our question and answer session, or should we go on? Can we use spot on for cats? I'll answer this very quickly. Yes, absolutely. We use spot on all the time for cats. Just make sure there's a cat picture on the spot on is what we tell owners, because you don't want to use the dog spot on for cats. Are there any of the spot ons that are toxic to cats? Fipronil is toxic to rabbits, just as an off, but cats, it's absolutely fine. You get a frontline cat. No, I think we don't get Bravecto or those fluranelair in for cats yet, but everything else we get Advocate for cats. We get Selamectin, which is Revolution, or Selamec for cats. Right. I think I've answered lots of questions. Shall I keep going?
Yes, that shows how interesting was the session.
Yeah. FE-tics, I haven't seen the FE-tics for cats. Lakshmi is asking, is this Dr. Lakshmi? Not sure. I haven't seen FE-tics for cats. We have used the FE-tics for dogs, but I have not seen FE-tics for cats, and I would not use anything on cats that doesn't say cat. It should come as a separate formulation for cats. Okay. And again, it has a pyrethroid, I think. Okay. Why no milk to cats? good point. So traditionally, people have been giving milk to cats, okay? And it is not that all cats are confirmed lactose intolerant, but they know that the lactase does start, the amount of lactase that is produced in the cat's body does start decreasing once kittenhood is over, okay? And therefore, what they are saying is that, look, the signs of lactose intolerance may not be overt, it may be covert. So your cat may have gastrointestinal disturbances. Anyway, cats are mysterious. To know what is happening with them is difficult enough. So what they're saying is that a lot of cats, there's a very large proportion, some 60% of cats who are actually lactose intolerant. So rather than, look for overt signs like diarrhea, vomiting, which will tell you that it's not, they can also have minor gastrointestinal upset, which is not visible to you, which can cause them to stop eating or go off feed or whatever it is. So it is not 100. So yogurt, for example, when you make milk into yogurt, the lactose gets converted and it is not harmful to cats anymore, harmful or doesn't cause intolerance in cats. So yogurt is actually okay for cats and you still get this calming effect. So if you don't do too much yogurt, again, you have to look at quantities, and your cat is not obviously intolerant to it, it may be an option. And if the owners are insistent on sort of offering the cat's milk, then, and the cat's doing fine with it, then there's no reason to interfere as such. But it's more because it can cause dietary intolerances, and they seem to show that a lot of cats have these dietary intolerances, and they can have, discomfort and nausea without actually overtly having diarrhea with it. I hope that answers your questions. Is Febantel contraindicated? Yeah, this is such a good question, right? Yeah, so this is a little bit of a hot topic because we had a product that's come out recently with Febantel. So Febantel per se is not toxic in cats because it has to be converted to fenbendazole. And actually all the kitten dewormers have fenbendazole, and I would have discussed this actually in the next lecture. But anyway, if we have time, I'll do it. But I think we're running out of time. We should go for the quiz, Dr. Sharma, after this. And cats are not so efficient in this conversion, and they seem to show a lot more adverse reactions to Febantel than to fenbendazole, okay, or than puppies do. So that's why you don't want to use a Drontal puppy in a cat. It may not be poisonous, it may not be toxic, but you may get a higher incidence of adverse reactions. This is what I read when I actually looked it up. The spraying ketamine, yeah, we spray all sorts of things, ACE, ketamine. Okay, so these are all off-label, spraying things into the cat's mouth. Even gabapin, they're trying to use it with propylene glycol on the ear of the cat and seeing if that gets absorbed. There's a lot of spraying into cats' mouths that's being done. I think everything's allowed in a fractious cat as long as you have the owner's consent and it's risk versus benefit. Please go ahead and try and stick within the doses though. Okay, thank you very much.